Adult onset diabetes is also known as diabetes mellitus type 2. This form of diabetes is a lifelong chronic disease that is manifest through high levels of blood sugar. This is the most common form. Diabetes occurs when there is a problem with the way the body uses or produces insulin. When you have type 2 diabetes, the body does not react sufficiently to insulin, which means the body is insulin resistant. This means the muscle cells, fat, and liver do not react normally to insulin. This results with the body's blood sugar not getting into the cells and being stored for energy. Abnormally high levels of sugar store up in the blood when sugar cannot enter the cells. This process is called hyperglycemia. These high levels of blood sugar can often cause the pancreas to produce more insulin, but it is not sufficient to continue with the body's demand. Type 2 diabetes causes those who are overweight are at a greater risk of becoming insulin resistant because fat interrupts the body's power to use insulin. Type 2 diabetes can also develop in those who are thin, particularly with those who are elderly. Genetics and family history can also play a role with developing this disease. You can also considerably increase your risks of developing this disease by a poor diet, excess body weight particularly around the waist, and having a low activity level. Other risk factors: triglyceride level that is greater than 250 mg per deciliter, or a HDL cholesterol that is less than 35 mg per deciliter, being older than 45 years, having high blood pressure, having polycystic ovarian syndrome, having impaired glucose tolerance in the past. Hispanic Americans, Native Americans, African Americans have higher rates of diabetes. Type 2 diabetes symptoms. Often people may have no symptoms, but if they occur, they may experience a need to urinate frequently, greater appetite, infections that heal slowly, increase in fatigue, blurriness to the vision. Treatment. Managing type 2 diabetes begins with the goal of lowering the levels of high glucose in the blood. Diabetes-related complication prevention is the long-term goal. This is done by starting with a healthy diet and exercise regime. Learn more at type-e-diabetes.info.